What are the main findings of the study?
The main findings of this study is we took the data from the Asthma IQ program, which is data compiled from primary care physicians and specialists as to the features of their asthma patients. And what we tried to do is we looked at that data to see is there any relationship between certain comorbidities and level of asthma control. And what we found was that there were some clear associations with well-controlled, not well-controlled, and poorly controlled with increasing levels of specific comorbidities. Reflux was more likely to be associated with not well-controlled, as was obesity. Depression was clearly more associated with poor control compared to people who weren't depressed. And for the pediatric population, which is what we're looking at with the secondhand smoke, is that it's a black and white not well or well-controlled association. It didn't seem to get worse as for more poorly controlled. Interestingly enough, rhinitis didn't track along those same lines with control, so it appears that control is going to be more associated with reflux, obesity, and depression on a linear fashion.
How do you think this study will affect patients in the future?
I think it will help with the providers to be more aware of some of these comorbidities as to whether the comorbidities are driving the poor control or the poor control is making the comorbidities worse is unclear. But I think it gives you a clear association that you need to treat both the asthma and the comorbidities to try and achieve better control.
What is your take-home message for primary care physicians and allergists?
Is to continue to see the patient as a whole, is that we've got just our asthma section, which is what we look at with this, but unless you treat the other diseases, is that you may not achieve the control that you wish or desire.
Where do you think this type of research is heading in the future?
I think this is looking at outcome research. Most of what we're trying to do is show that our care improves patient outcomes. And if we're showing different outcomes based upon comorbidities, we need to kind of focus on improving the outcomes by improving the comorbidities.
Thank you.